everyone, welcome back to the channel MLT Lectures. In this video, we will learn about erythrocyte sedimentation rate, also known as ESR. Here we discuss about principle of ESR, its stages, methods to determine ESR and its normal values. First, moving towards the principle. When an anticoagulated blood is allowed to stand undisturbed for a period of time, the RBCs tend to sink spontaneously to the bottom, displacing the plasma, which move towards the up. This process is called sedimentation. Here we can see when an anticoagulated blood is allowed to stand undisturbed for a period of time, that is 1 hour, the RBCs sink to the bottom, displacing the plasma towards the top. This process is called as sedimentation or erythrocyte sedimentation, and the rate at which the RBCs fall down is called erythrocyte sedimentation rate. As we can see here in this figure, in first figure, the tube is full of RBCs, and after 1 hour without a disturb, the RBC has settled down here below, displacing the plasma. This displaced portion is termed as ESR. Next, ESR has 3 stages: stage of aggregation, stage of sedimentation, and stage of packing. This whole process takes about 1 hour. First, looking to stage of aggregation or Rayleigh formation. This is the initial stage during which red cells tend to form Rayleigh, and this stage lasts for 10 minutes. Rayleigh means RBC forming a stack of it like a coins. You can see here in the figure. This takes about 10 minutes. Second, we have stage of sedimentation. In this stage, the RBC settles down in a constant rate for about 40 minutes. The larger the aggregates formed in the stage, the rate of fall in the stage is faster. This is related to both weight of the aggregates and the surface area. Last, stage of packing. This is the final stage during which, when both the individual cells and aggregates slow down due to crowding, and this stage lasts for 10 minutes. There are 3 ways to determine ESR: Western green method, Winthrop method, micro ESR method. First, we will look in detail about Western green method. Requirement are Western green tube first, which is actually a pipette which is 30 cm long and have an internal diameter of 2.5 mm. It is calibrated in millimeter from 0 to 200, and it holds about 2 ml of blood. Then next we need is a Western green tube rack holder, which helps to hold the pipette vertically. Next we have rubber bung on which pipette tip is placed, and next spring clip. Here we can see the figure of Western green tube and tube stand. Next, anticoagulant we use for determining ESR is usually 3.8 sodium citrate in the ratio of 4:1, that is 1.6 ml of blood with 0.4 ml of anticoagulant, or even we can use EDTA. Mix 1.6 ml of anticoagulate blood with 0.4 ml of normal saline. Now, procedure. Draw the anticoagulated blood in a western green tube up to 0 mark. Then, the pipette is clean wiped in the outside and the pipette is placed vertically for 1 hour without any disturbance. Ensure that there is no air bubble in the column. Start the stopwatch and take the reading at exactly 1 hour. The reading corresponding to the upper layer of the RBC column in the pipette is taken. Here we can see normal values. ESR in men and humans are different and it changes according to the age also. So, below 50 years, men have 3 to 15 mm per hour, women 3 to 20 mm per hour. Above 50 years, 3 to 20 mm per hour in men and in women 3 to 30 mm per hour. Above 85 years, for men, the ESR normal value is 3 to 30 mm per hour and for women it's 3 to 40 mm per hour. Next, second method is Winthrop's method. Here, requirement is Winthrop's tube that is 110 mm long and its internal diameter is 3 mm. It holds about 1 ml of the blood. Next, Winthrop stand and anticoagulant here uses EDTA mostly. Next, method or procedure to do ESR from Winthrop's tube. The Winthrop's tube with the anticoagulate blood usually using special long pipette up to the 0 mark near the top of the tube, marking sure that there is no air bubble in the column. The tube is then placed vertically in the stand and note the time. At the end of exactly 1 hour, examine and note the reading of the label of the top of the red blood cell column. The reading in mm correspond to ESR. Normal value of ESR by Winthrop's method is for males it's 2 to 10 mm per hour and for female it's 4 to 20 mm per hour. Next we have micro ESR method. It is a plastic tube graduated from 0 to 50 mm. The anticoagulated blood is the anticoagulate is filled with the help of suction device. After mixing the blood in the bulb, the suction device is detached from the pipette and place the finger over the top of the pipette and make the anticoagulate blood at to 0 mark. The tube is placed vertically and the reading taken of the red cell column at exactly 1 hour. Useful for infants and small children since small amount of blood is needed. That is, only 0.2 ml of blood is required for this method. There are various factors affecting ESR in it may be physiological factor or a laboratory factor. In physiological factor, it includes plasma factor, red cell factors, age, sex, and pregnancy. In case of laboratory factors that affect ESR are temperature, time, anticoagulant, or tilting of the tube or any movement. Now, interpretation. As I said earlier, it is not a specific test for any disease. It is a prognostic test tool for disease. We can see ESR increase during tuberculosis, rheumatoid fever, rheumatoid arthritis, myocardial infarction, necrosis, anemia, SOX, and leukemia. And decreasing condition is seen during infants, polycythemia, congestive heart failure, allergic stage, and spherocytosis. Thank you. Hope you like the content. Please like, share, and subscribe the channel.